Today we're going to talk about the different types of anesthetics that we use in dentistry. And more in endodontics, which is my specialty, management of pain. Normally patient comes when they have acute pain or they have discomfort. What do we have here? We have different types. One is lidocaine, can be xylocaine, but lidocaine is the most common. And lidocaine, this is an anesthetic that you can utilize when you need to have 2-3 hours duration, and it's a very safe anesthetic, all of the ones that we use today. And if the patient doesn't have any heart problems or blood pressure that is out of control, then usually you can use the anesthetic that is plain. It's called plain. In this case, I have mepivacaine, but it's carbocaine, Citanest. The issue is it has to be plain. What is the meaning of plain? Plain means it doesn't have epinephrine, like the lidocaine that I introduced you here. Epinephrine is the liquid that is gonna make the body to resist or keep more or keep the anesthetic longer. And this one is plain, so the duration is not too much, but it still is an hour, hour and a half. And it's not gonna increase the blood pressure of your patients. Now, if we use this one that is also lidocaine, but it's a high concentration, this one is to stop during surgery that I'm gonna introduce you later with my patient that is a volunteer, that is gonna be placing in the bone vessels that if there's a lot of bleeding during our surgeries, we're gonna use this type of anesthetic that has a high concentration in epinephrine and lidocaine. Now, septocaine, it's another type of anesthetic that is not too much in use in dentistry, but one of my dentists that I work, a very good friend of mine, told me that it's used in the military. She's part of the reserve. I love her. And she gave me the tip if I want more duration to use the septocaine for my patients. So what is the syringes that we use? The syringes that we use, it was closed. We have to be sure always, I'm sure all our colleagues have sterilized, so these bags are closed for the sterilization of the syringe, because the needle it comes separate. So once we open the needle, it has to be used for each patient. They don't get the chance to be used in another patient, always in one patient. And they have to be trashed, all this, for the patients, but I'm very sure all the dentists do. So when you're gonna put an anesthetic for the upper teeth, the recommendation that we give to the students, this is a needle that we used before for our episode in Spanish, so we have to bend it a little bit, but we use and we start putting the lip up. That's what I do. The bevel of the syringe has to be up, so this little opening is a bevel here. And when I pull through the tissues, when I wanted to pull a tissue, I pull the tissue and I start putting the anesthetic drop by drop. So you see here in the model, in my patient, I said, are you having pain? Usually the patient say no. By then, I usually have the patient grab in a certain way that if the patient moves, I usually have a control on this. So if we go drop by drop, you will never have pain. That's what I do. Very few patients do that. If you want to put the syringe deeper, you can bend it this way, because if you go higher in this way, then you can get numb your eye. So we know that in dentistry. If you want to put it this way, also move it without having to place again the syringe on the patient. The same way in all this area. I go very slow because this area, it's very painful to place. And when I go to the palatal side, I learned from Dr. Matsunaga a technique that you go through the gums, actually, and I start putting and passing the anesthetic to the other side. So then this part of the palatal is numb enough, so when I wanted to place another anesthetic for the palatal area, then it has to be placed, I don't know if it can be observed, in this area also very slowly. And for the palatal, I always change and I use a plain anesthetic so you don't get any irritation on the palatal doesn't have a lot of innervation, so a circulatory system, so you can cause a little bit of a necrosis if you put a lot of anesthetic. So always tell your dentist, if you want, doctor, are you gonna put me a little bit? I just don't want to have a necrosis or a problem in my palatal. Now, what happened when the patient said, I am numb, but I still feel pain? Well, the dentist can change to another technique using a different type of anesthetic and technique that is called PDL, is for the periodontal ligament. And what is the ligament? I explained at the beginning of the shows. This purple that you see here around is kind of a rubber all around the tooth that it works as a cushion, so the teeth are not crashing down. So when we're doing the mastication, they have a cushion to have where to stop when we're doing a mastication. So in that ligament is where we're gonna put the anesthetic. And how do we do it? I like this syringe, but also we can use this syringe where also you place the needle like this one, and then you start with the needle, you start going between the gum and the ligament, between the bone and the ligament, so the anesthetic gets in and numb the patient. So let's say after the doctor put so many anesthetics, and we're talking about the upper, but it's the same and the lower, and he said, it's bothering me too much, then you go with the syringe and the needle, remember, between the bone and your tooth where the ligament is, and then we start pushing very slowly again, or see how it gets stuck? That's the ideal way of the technique. So after that, if the dentist continues, especially in endodontics, if you having a root canal, let's say you having a root canal and the pain is really bad because you've been with this very acute pain because all the caries went into the tooth and start getting into the nerve. Now it's inflamed, it's a big abscess, and the abscess, is around here, whatever it is, but the acidity of the abscess is not gonna give you a chance to get sometimes the anesthetic. So in endodontics, we have another one that we use to, is like a osteo for the bone. And in this one, we open the container as we did, and for practical purpose, we took out the syringe. It comes, this container, you take it out, the needle, not the syringe, the needle, and any one of the anesthetics, like if I try, in this case, we start going and drilling. Let's say we're gonna drill in this area. We choose between the teeth, but it has to be on the bone. It's very important that I know your endodontist will not to be careful so they will not perforate any one of your roots, because these are the roots. So that's why you have to be a very well-trained dentist that usually they tell you in the school, especially in endodontics or any specialist. So here you put the needle and in between you start getting like a perforation. And then here I'm simulating because I don't want, this is a courtesy loan from Dr. Bijak, I don't want the patient is gonna complain. So we gotta place it, and immediately the assistant, once I make the hole, the assistant has in her hand right away this syringe that I go, but this is the interesting part of this case, that once you do the hole, we have a marker that it will teach us how are we gonna place, the anesthetic, and then we go and continue and get stuck wherever we did the perforation and start getting through the bone in this way. So once this is finished, there are details I don't have to tell you, but that is the bottom line of how to use the different types of anesthetics, the different technique. The point is that you are out of pain. Sometimes an anti-inflammatory can help. But for now, concentrate our topic in dental anesthetic. I hope you like it, and subscribe in our YouTube channel, Instagram, and TikTok. Thank you very much.